The CHRISP team has expertise in medicine, public health, epidemiology, statistics, data linkage. So we actually have a team of people with expertise in those different fields, which actually enables the research to happen in a timely manner as well. So that's a really good thing. The University of Wollongong and the local health district, Illawarra Shoalhaven local health district, developed a research partnership 2 years ago because they wanted to use this sort of wonderful expanse of data that they've had, up to 30 years worth of clinical data, to use it for not only health service planning but to also improve clinical practice. So the partnership and the research that they wanted to undertake was looking at priority-driven research, which is something that the health service itself decides are their priority areas. And they also wanted to do clinician-driven research. So when the clinicians have a burning question that they want to ask, they actually ask us if we have the data that will actually complement that research question, and they can derive the findings and then use them for improving clinical practice or for improving health service delivery. The goals are, number one, to address the needs of the local community in terms of research and health research. Two, to actually provide access to high quality data for that research. Three, to actually build capacity for research within the local health district and the university. And four, to actually translate the research findings into practice so that they can actually have access to, the findings of research in a timely manner, and then they can actually put them into service planning or clinical practice.
Now we're at the stage of bringing managers and clinicians together with academics, statisticians, epidemiologists, and we're actually seeing, I think, an exponential impact starting to occur where the number of projects, the amount of research that we're doing has accelerated, and it's really exciting.
The clinicians in the emergency department have worked closely with the university to look at the type of patients that are presenting to our emergency departments. We found that the university was helped concrete what we thought by analysing millions of patient records and data, the sort of things that we can't do every day. At the hospital, we've collaborated here with the university, with people like Dr. Louise Lago and AHSRI, to try and do the kind of things that we can't do with big patient data. So the CHRISP database used our own information, but it was given back to us in a way that we could sort of synthesise it. So we ran a workshop that had sort of 30 or 40 clinicians at it, and at the same time had university researchers in the room, and that helped us really understand what it was that we were seeing in our patients every day.
One thing we've looked at is whether patients who are a frequent attender to the ED in 1 year remain a frequent attender in another year and subsequent years. And the results were quite surprising. 80% of people who are a frequent attender in 1 year are no longer a frequent attender in the next year. In research, having translation, so making changes to practice, really relies on the clinicians being involved in developing the question as well as developing the answer. Sometimes they don't have a lot of say in the question, they just want to know what the question is, and other times they really help shape the question, but having them involved in understanding and interpreting the data, in running the workshops and in making changes in the hospital means there's a much better level of engagement and trust in what you're doing. So we really believe that with research, if you don't have clinicians involved right at the start, they don't want you to come in the end and say, oh, look what we found about your emergency department. So that's been really crucial to the success of what we're doing.
What excites me about this is that through the research that we're doing, we will be able to ensure that we target our services in the right place, and we also ensure that the person gets the right services at the right time, and therefore if you pull all that together, the patient will have much better outcomes and a much better quality of life.